Hi, I'm Dr. Brant Pedersen, and in this video we're going to talk about the connection between your sacroiliac joint and the largest nerve in your body, which runs through your buttock and down the back of your leg, called the sciatic nerve. It's a cause of something called sciatica, which can be incredibly painful, but most people don't know that SI joint dysfunction and SI joint instability and fixation, we'll talk about what all of that means. They don't know the connection between that and sciatic nerve pain. Let's talk about the sciatic nerve. The sciatic nerve is the largest nerve in your body, but the sciatic nerve is quite large, and it transmits through the lumbar vertebrae out past the disc, down into the buttock region, and then down the back of the thigh. It splits then into the rest of the nerves that go into your calf and foot, and it controls the ability for your muscles to move, and also the sensation, hot, cold, pain, those type of things, for almost all of the nerves that go into your leg and foot. So when someone has a problem with the sciatic nerve, and it's usually because of compression, I'm going to talk momentarily about the things that compress or pinch on that sciatic nerve, but when people do have that, they'll have pain. It can be in the buttock, down the back of the leg, and into the calf or foot. What are the things that can compress the sciatic nerve? Well, we can get compression where the nerve or the nerve fibers exit the lumbar vertebra. So that can be caused by a herniated lumbar disc or a disc bulge in the lumbar spine. It can be caused by arthritic changes around the canal. It's called the intervertebral foramen, where the nerve comes out. It can also be caused by spinal stenosis, and there's two different types of spinal stenosis that can happen: central canal stenosis and lateral recess stenosis. In general, central canal stenosis will cause symptoms down both legs, and lateral recess stenosis many times just causes symptoms down one leg. So how can sacroiliac dysfunction or SI joint dysfunction lead to sciatica? Well, usually it is through the mechanism of the piriformis. So let's talk about the anatomy here for a moment. Your sacroiliac joint or SI joint is the joint between your sacrum, which is this triangle-shaped bone, and your ilium, which is this bone of your pelvis here. You can see it on the back here and on the front here. That sacroiliac joint is supposed to move back and forth slightly, a few degrees, every time you take a step. It's the thing that gives you that sachet in your hips. And if you ever watch someone walk with SI joint dysfunction that's fixated, it'll look like they don't move their hips at all. They're just moving their upper body and their legs, but nothing in their pelvis. The SI joint is held together mainly by ligaments on the front and on the back of the joint. And there's one muscle that specifically crosses the SI joint, and it becomes a problem when the joint is either fixated or too loose and unstable. That muscle is called your piriformis. Piriformis comes from your lateral hip here, across here. It runs right through what's called the sciatic notch, sciatic nerve, and goes and attaches to the front of your sacrum. You can see, therefore, it's crossing right through that SI joint. And so what can happen with that piriformis muscle is, if this is your sciatic nerve, it will pass right underneath that piriformis muscle, right through the middle of it. And so you can get impingement of that sciatic nerve as it runs through this area, and all the symptoms that it could cause down your leg. The piriformis muscle can become irritated in a number of ways and cause compression. It can have myofascial trigger points in it that cause the muscle to be tight and not want to release. It can also have myofascial adhesions that adhere the sciatic nerve to that piriformis muscle. Before we talk about specific causes of sciatica and the solutions and things that can be done to help that, I want to let you know that most of the time, I believe that there are causes to people's symptoms, but most of the time, medicine, healthcare is treating symptoms. Treatment comes in instead of treating causes. And if you don't address the cause, the symptom remains, the symptom comes back. The hardest thing that I do in my practice is to discover for each patient what that specific cause of their pain is, because there's many different things it can be. And if we address that cause, then the symptoms go away, usually quickly, and they stay away, usually with things that aren't that difficult to do. So I want to say that if you are dealing with sciatic pain or other type of pain, don't give up. I believe that if you aren't getting the results from working with your provider, that you should look for other providers that can help you out. The first cause and solution of sciatica comes from SI joint instability. SI joint instability can come on from trauma, like a fall onto your buttocks, a car accident, those type of things, creating instability in the ligaments around the SI joint. And when that happens, an SI belt, a trochanteric belt, a Sorolla SI belt can be really good at holding those SI joints in better approximation so that those ligaments can heal and that piriformis muscle can calm down in pelvis and adjusting at that SI joint. That creates a shearing motion, so you want to avoid that.